I have a little bit of a cold, so hopefully that's not going to affect me too much tonight talking. But what I wanted to share is that, well, basically, how many people have seen or know about naturopathic medicine or orthomolecular medicine? Can you put your hands up? So quite a few of you. Can't really see that well, but basically, I just wanted to explain that naturopathic doctors are trained the same as medical doctors in terms of the basic sciences. And we dissect cadavers and we study pharmacology, but the basic difference is that we just don't use drugs to treat. And what we do use is botanical medicine, nutrition, orthomolecular medicine, acupuncture, and traditional Chinese medicine, lifestyle counseling. And in my own case, I have additional training in Gestalt psychotherapy, compassion-focused therapy, and cognitive behavioral therapy. And in my practice in Edmonton, I specialize in mental health, and that means basically any condition that you would find in the DSM manual that the psychiatric community uses. So depression, anxiety, schizophrenia, borderline personality disorder, OCD, ADD, bipolar disorder, basically anything that you would find in that, in the DSM manual. And my approach really is to assess 8 sort of areas that I think are really important to making sure that you maintain mental wellness. And so the first 4 are looking at obviously your diet and supplementation, orthomolecular medicine. And then we look at stress and sleep and exercise. And then on top of that, then I look at your thought processes, your emotions, how you behave and react in the world, and your spiritual beliefs. And then I wrap that all up in basically looking at compassion and self-love, because I think that it all comes back to that at the end of the day. In my own case, I haven't always been a naturopathic doctor. I did have another career. And what happened to me was I was diagnosed with pretty severe mental illness in university. And after struggling for about 13 years, I ended up going to the Orthomolecular Society's Mental Health Regained Public Forum in Vancouver, and I met Dr. Hoffer, and I ended up becoming his patient because I wanted to have my mental health regained. And I became his patient, and after starting his protocol, I had my first year where I actually was stable and free of a lot of the conditions that really paralyzed me in my life. So, depression, anxiety being 2 of the main ones, but there are others. And eventually I did get well, and then I began to investigate, what did I really want to be doing with my life? And it wasn't doing what I was doing, and I ended up then inquiring about how you practice orthomolecular medicine, and discovered that you had to actually either be a medical doctor or a naturopathic doctor. And naturopathic medicine fit more with my philosophy and belief system, and so I became a naturopathic doctor. So that's basically my very short story. And if there's any questions, then I'm happy to take them. And again, thank you for coming.
Great. So we have a lot of good questions here.
Okay.
A couple.
I think I'm showing my age here, hey? It's hard to see. Are multivitamins a good, suitable substitute for vegetables? I would say that the answer is multivitamins are a good insurance for sure, but diet is really important to get that right. I see a lot of people who eat fast food and they think, oh, it's fine, I'll just take a multivitamin and that's okay. You know what? That's not really okay. You need to get the diet right. And yes, you can add a multivitamin, and that's a good thing. But I just find that multivitamins, there isn't a lot of benefit in the sense that there's just a little bit of of everything in there, and not really enough to, from a medicinal point of view or orthomolecular point of view, to kind of get that concentration right, especially if you have a mental illness. So I would say that you would need to see somebody in Calgary or wherever you live, see a naturopathic doctor and get on something that might be a little bit more specific for your individual needs. How do you manage the flashing effects of niacin? That's a tough one. That's basically one of the side effects of niacin, is that it causes a flush. It causes a histamine release, and what that means is you get very red, you get itchy, you get really warm. It's like you're having a hot flash, but a hot flash on steroids, basically. And so there is really nothing you can do except for to make sure you take it with food. And I would say to divide it up in smaller doses throughout the day. That would be my main suggestion. But there really isn't a lot that you can do. I've been taking niacin for, several years now, and I still flush every single time. So I haven't found a solution to that for myself. Do they test blood to see what the levels of niacin are before they begin treatment? And if so, who decides what the normal level is? You can test the levels of your blood levels of niacin before. Yes, you can. There's a test through a lab called SpectraCell that does whole red blood cell testing. And the reference ranges are basically given, and they're not necessarily, I would say, again, enough for orthomolecular, to satisfy an orthomolecular approach. So a lot of the reference ranges that are given are low, in my opinion. And as a naturopathic doctor, what we try to do is practice what is called optimal or functional medicine. So we look at the reference ranges that are given for nutrients. For example, I usually use ferritin as an example. That reference range is 12 to 300. And so if you're at 13, your medical doctor will likely say that you're fine. But really for us, that's not optimal to be at one above the low end of that range. So we look where you are within the reference range and make recommendations accordingly. Besides niacin, what exact lifestyle changes are prescribed within orthomolecular medicine, and how is this determined? And how does the prescription differ between people? It really is an individual approach. So you really have to sit down with a practitioner and have them take your case. Lifestyle changes include, like I said, looking at your diet, addressing any food intolerances that you may have: wheat, dairy, sugar, eggs, taking those things out of your diet. And then looking at your sleep. How is that managed? Are you getting enough? Looking at your stress levels, again, and are you exercising? So again, it really is an individual approach. And I would, if you haven't seen a naturopathic doctor, I would say it's the best investment that you could ever make for yourself. How does the prescription differ between people? It is completely different for every individual. This is not a cookie cutter approach. This is an individualized approach based on your individual needs. Will the symptoms come back if someone that has healed from schizophrenia, if someone who has healed from schizophrenia stops taking the vitamins and eats well? I can't really read the very well.
Will the symptoms come back if someone that was healed from schizophrenia stops taking their vitamins and eat well?
Let's say after a couple of years. Again, I would say it's difficult to answer that question, but I would say I can tell you in my own case, when I have gone off my regime, I have ended up in the hospital. So I would say you have to stay on it. You really do. Just like Haile Cass said in that last movie that we watched, If you've got the propensity, you're not cured. You have the propensity. You need to stay on this. You need to continue taking your vitamins. You need to continue to eat well. I live a pretty rigid life in some aspects. I get up at the same time, I go to bed at the same time. I don't check my email after 5 o'clock at night in case I get something that could set me off, could disrupt my sleep. I don't like to watch TV. I have a husband who's a CBC junkie, and I hate the news. I really protect myself from anything that's negative. So I would say that, the difficult thing with people, it boggles me, and I fall in the same class, is we hate to take anything. We don't want to take a prescription, we don't want to take a supplement. But the reality is, you've got to do something. And I think that taking a nutraceutical approach to your health is a far more logical and natural approach than a pharmaceutical approach. But that's just my opinion. I have a lot of strong opinions. Okay, what affects the metabolism of adrenaline? And can you pin any evidence down to schizophrenia especially? That's a tough question. I might have to find out whoever wrote this one and get back to you on that one, because the metabolism of adrenaline is affected by the nutritional cofactors that help to break it down. And as you heard in the movie, this adrenochrome hypothesis, I completely subscribe to that theory. In my own case, as soon as my stress levels go up, my health goes down. And I don't think that that's unusual in just the average human. But for me, with that propensity to potentially not break down adrenochrome or adrenoleukin, it does act as a hallucinogen, or can you contribute to psychotic episodes. And so I don't know enough about the biochemistry with that specifically to answer the question, except for to say that I think it's a big problem. So if you want to approach me after, I'm happy to look into it further. And I guess what I will say is that, on the Canadian Society of Orthomolecular Medicine's website, which is csom.ca, you can have access to 40 years of the Journal of Orthomolecular Medicine, and so that is a good place to start looking for the answer to that question. Dose makes a poison. How can synthetic drugs be demonized? Is that right? Versus natural molecules that have a
low and high end as well. How has Pauling's vitamin hypothesis worked out so far?
I'm not sure I quite understand the question. But I think what we're trying to say is that potentially supplements can have a toxic effect if it's taken at too high of a dose, and drugs can have a toxic effect as well. I think the difference is that with vitamins, you have two classes of vitamins. You have water-soluble vitamins and fat-soluble vitamins. And so the B vitamins, and basically there's only 4 fat-soluble vitamins, vitamins A, D, E, and K. Those are the ones that have the potential to be toxic in your system. However, it requires extremely, extremely, extremely high doses for that to happen. The water-soluble vitamins are just that. Your body is going to excrete, you're going to take what you need and you're going to excrete the rest. The exception to that rule is vitamin B3. At very, very high doses of B3, there can be an effect on liver enzymes. So that does have to be managed somewhat. And if you are a practitioner and you are treating people with schizophrenia, bipolar disorder, depression, etc., using B3, you do want to make sure that you are checking their liver enzymes from time to time to make sure that they are within the normal range. And then the second part of this is, how has Pauling's vitamin hypothesis worked out so far? I think it's worked out quite well. I mean, he won 2 Nobel Peace Prizes. He was instrumental in bringing awareness with respect to vitamin C and cancer treatment. While I don't necessarily specialize in cancer in my practice. I do have colleagues that specialize in oncology, and vitamin C is one of the primary treatments that they do use for treating cancer. So I think that what Pauling paved the way for us, and then Dr. Hoffer, and then all the rest of the orthomolecular practitioners that are out there today. To what extent is the increased incidence of schizophrenia or other mental illness simply an increase in diagnostic capacity? Yeah, that's a great question. The DSM manual is coming out with its 5th edition next year, I believe, and they're going to be having more and more classifications specifically to children, to capture them into the classification of mental illness at early ages. And in fact, my husband, who's also a naturopathic practitioner, had a 3.5-year-old child in his office the other day labeled with bipolar disorder, which I think is absolutely ludicrous, because if you know anything about bipolar disorder, it doesn't typically manifest until you're over the age of 16. But now, all of a sudden in the last 5 to 10 years, it's happening in 3-year-olds. So I think that we could relabel that whole manual with, I just call it thought pathologies or something to that effect. It doesn't do anything to address any of the underlying conditions. I mean, how many times have you been to a psychiatrist, and how many have they ever asked you, how is the stress in your life? What's going on in your life? How are you coping? How are you managing? How's your diet? You don't get asked those questions. You just get asked, not very much really, and just enough to try to classify you into a box to prescribe a pill. And the difference between naturopathic doctors and medical doctors, in my view, is that we're more interested in knowing who you are as an individual and what makes you tick and what you're all about, than basically being able to classify you with disease A, B, C, or D, so that we can prescribe drug X, Y, or Z. That's not what we're about. And that's a really big differentiation that's important. What is the dose of B3 or niacin per day, and can you use niacinamide? So again, it's really hard for me to say what the dose would be for you, because I haven't taken your case and I don't know what your health concerns are. And I would also really want to caution you and everybody in the room here to not necessarily go run out and buy niacin, because I can tell you, when I saw Dr. Hoffer in Victoria, and then I had to take the ferry back to Vancouver where I lived, between that 4 or 5 hour journey, I completely forgot about him telling me about this flush reaction that was going to happen. So when I got home, I was pretty excited to get started, and I took the B3, and I was talking on the phone to my friend, and I had this horrific reaction that I'd never had in my life. And I said, I gotta go to emergency, I don't know what's happening to me. And she said, well, what did you take? What was prescribed? And I told her, and she knew about B3, and she said, oh, you're just flushing, and didn't he tell you about that? And I said, oh yeah, he did. I completely forgot about it. So if you want to, you can start on some B3, but just be aware that if that happens, it's not an emergency, it's just a natural reaction, and it will go away within 20 minutes. And a funny story too, the other day I was in the pharmacy, and this guy in front of me, he was having a flush reaction, and he was holding the bottle of niacin and saying to the pharmacist, give me something to make this go away, I just took this, I'm having an allergic reaction. And I piped up, and so did, and the pharmacist as well. We both said, oh no, that's there's nothing we can do, that's just what it does to you. It's not an allergic reaction, it's a normal reaction. So, but basically, in terms of treatment for schizophrenia and bipolar disorder, it is high doses of niacin. Like, we're talking 6, 9, 12 grams a day of niacin. And that's a lot. The average person can't even handle 100 milligrams. So in terms of niacinamide, yes, you can use it. Dr. Hoffer, for his protocols for depression and anxiety, he uses niacinamide. Niacinamide is a form of niacin, but it's a non-flushing form, and its molecular structure is just a little bit different than niacin, and it still has to you still have to require a conversion step in the body to get it to niacin. If you have any problems in that pathway, then it's not going to work for you. The films criticize the drug industry and their obsession with making money. What about the vitamin industry? Yeah, that's the thing. At the end of the day, everything is business. I find in our society, we especially in Canada, we feel like it's our God-given right that healthcare is provided to us and for free. But I don't think we really fully understand that we're paying that price through our tax rate. There's nothing for free. Everything does run, at the end of the day, it is a business. But I can say that the true cost of pharmaceutical drugs is much, much, much more expensive than a simple therapy like niacin, which is going to cost you maybe $20 a month. I mean, there was a time when I was taking Prozac and it was $3 for one pill, and I had to take 4 of them a day. I mean, that's expensive. So I don't really think it costs that much money to make that medication. So, it's difficult to get around that, and but I think for me, I choose the vitamin approach because I believe in that philosophy, and I like to think that that is more in alignment with my views. So. What is the scientific evidence for the success of orthomolecular medicine in the treatment of schizophrenia? How is successful treatment measured? And are these patients on pharmaceutical medications as well? Again, this is an individualized approach. I can tell you what has happened in my practice with my schizophrenic patients, and also with Dr. Hoffer from what I know of his practice. And it's funny, one of the main questions he'd ask every patient is, basically, are you working and are you paying income tax? I mean, to him, the most important thing was, are you a contributing member of society? Are you able to work? Are you able to get up and start your day and go out there and feel good about yourself and earn a paycheck? That was really important to him. He was the first psychiatrist that ever asked me if I had a job. And so I would say that it really depends on the individual. I have some patients who have recovered from schizophrenia. I have other patients that they're due both. And the nice thing about this approach is that you don't need to take as much medication. Yes, you might have to take a little bit, but you definitely don't have to take as much. So you're not riddled with the side effects that can happen if you're taking Seroquel or risperidone or lithium or whatever it might be. Some of these side effects are very, very, very difficult. And so the nice thing about the orthomolecular approach is it allows you to really minimize the medication that you're taking. And I'm not anti-medication. I mean, I do believe sometimes a little medication goes a long way, but I agree with Dr. Hoffer. Use it as a crutch. Get yourself walking. Then once you're walking and running, throw away the crutch. You really don't necessarily need it. So that's it. Thank you very much.
So thank you very much, Dr. Bjorndal, for volunteering your time. And I know you're not feeling well, so it's even more extra special to have you here, which doesn't make sense, but you know what I'm saying. And to show our gratitude, I'd like to present you with a token of our appreciation, the Vitamin Cure. And yes, so thank you so much. And if anybody has other questions for Dr. Bjorndal, you will be here till 9. So you can feel free to track her down out in the lobby. But for now, Ian is going to pass out some evaluation forms. So if you guys are so inclined, please feel free to fill out an evaluation form. It just helps us when we plan events in the future to just make them all that much better for you guys. So if you do have the time, that would be great. And when you're done with that evaluation form, you can hand it back to Ian. And as a final hurrah, we are going to do the draw for the lovely gift basket that our generous sponsor, Community Natural Foods, has donated to us. So, oh, we've already picked a name. Very good. That is beautiful. Thank you, Shelley. And the winner is Dave Grant. Dave Grant. Come on down. You're gonna get some goji berries, some chia seeds, all good stuff.